Welcome to our live event, Itching to Know About Psoriasis, a Heroes webinar for beauty professionals, hosted by the Global Healthy Living Foundation with support from Amgen. I'm Dr. Laurie Ferguson, the Director of Education Development at the Global Healthy Living Foundation, and I'm delighted to have you all here with us today. The Heroes program, which stands for Health Education, Reliable Outreach, Empathetic Support, was launched in June 2023. It was created by, with, and for stylists, salons, and barbershops, with input from patients and healthcare professionals, with the goal to equip salon professionals to better support their clients who have skin and scalp conditions. Psoriasis is not just about the visible symptoms of the skin and scalp. It's so much more than that. And that's what we're here to learn about. It impacts physical and mental health. And it's crucial that we bring together diverse perspectives to explore our understanding of this topic. Our goal today is to equip you with the tools you need to better understand and support those living with psoriasis. We have a remarkable panel of experts, including board-certified dermatologist Dr. Elda Mall, psoriasis patient and award-winning writer Alicia Bridges, creative barber and psoriasis patient Brittany Timms, and myself, a clinical psychologist who counsels many patients with chronic disease like psoriasis. Together, we aim to bridge the gap between beauty professionals and patients. We want to give each of you knowledge and insights so you can recognize signs and gain some understanding of the lived experience of your clients who are psoriasis patients. We believe that this will help you communicate effectively with your clients and improve the experience in the salon. We're on a mission to normalize the condition, to reduce stigma, and to create a space where everyone feels supported. So this webinar is for you. We want you to be an active part of it. We encourage you to ask questions using the Zoom Q&A feature and share your experiences in the chat. Let's have a dynamic and engaging conversation. And then we'll take some time toward the end of the event to go through any unanswered questions. So let's begin. Let's learn and grow as a community. And thank you for joining us on this important journey. As we kick things off, I'm going to ask you each to drop a quick hello in the chat and tell us where you're tuning in from today. We'll begin to get to know who's present here. And as you're doing that, I'm going to turn to my first question, which is for Dr. DeMol. Dr. DeMol brings a wealth of experience and so much expertise. She holds memberships in the American Academy of Dermatology, the American Society of Dermatopathology, the American Society of Cutaneous Oncology, and she's a member of the Heroes Medical Advisory Board. Welcome, Dr. DeMol.
Thank you so much for having me.
We're delighted you're here. Can you help us begin by breaking down what psoriasis is in simple terms? What is it, and how does it affect not just the skin, but other parts of the body?
Absolutely. Psoriasis is an inflammatory skin disorder that we're just really starting to understand a little bit more about in the last decade. And that's led to a huge rate of new therapies for medicines you've probably seen advertised on TV. It has two components. It has a genetic predisposition and environmental factors that seem to trigger the disease to turn on. There are many different variants of psoriasis. The most common one is plaque psoriasis, which can affect the scalp, which is kind of where our discussion focuses today, but often it affects the flexure surfaces, elbows, knees, belly button. There are other variants of psoriasis that include guttate or a more pustular base. There's also, to the point of how else does psoriasis affect the body, about 30 to 50% of patients with skin psoriasis actually go on to develop psoriatic arthritis or have arthritis that precedes their skin binding. That is best managed in conjunction with dermatology with a rheumatologist who can identify these features.
Wow, that's a lot. Thank you for sort of giving us the whole overview of that. Now, as we sort of think about, as you said, about scalp psoriasis, for our stylists here today, what symptoms should they keep an eye out for when they have a client who has psoriasis?
Scalp psoriasis typically starts as a thickening and dryness of the scalp. The flakes of psoriasis tend to be very thick and stuck on, and when they're scraped off or caught with a fingernail, they bleed very easily because of the way that the psoriasis affects the skin ridges. That being said, in different skin colors, psoriasis can look pinker, it can look darker or thicker, and then the scales can be more or less present, often starting in the nape of the neck and moving forward. A clue for psoriasis, as opposed to other causes of scalp flaking, involves the back of the ears or even inside the ear canals. And psoriasis of the scalp really exists on a spectrum with something called seborrhea or seborrheic dermatitis or dandruff, which is an inflammatory skin condition that we understand is closely related to pityrosporum yeast, which is the yeast form, commensal yeast form that lives on everybody. Some people seem to trigger a reaction to that and get kind of a scaly scalp. So the definition of where seborrhea starts and where psoriasis starts, it's really more of a spectrum. And sometimes even in dermatology, you can't quite pin it down just based on the scalp findings alone. And so we call it sebopsoriasis. So there is this spectrum, and yeast may, play an irritant role in psoriasis as well. So, we don't necessarily need to split these two conditions.
So what you're saying, if we could just come back. So a stylist should be aware of what as they look at the scalp specifically?
They'll notice, as I mentioned, some scaling, that the classic, more commonly in medical textbooks, we show pictures of white skin. So it's a red rash on whiter, lighter skin. But on darker skin tones, it can look more purpley or like canified and thickened. And so may actually appear darker than the surrounding skin. But scale tends to be a big part of all of these rashes.
So really being attentive for that scaling. So thank you so much for that insightful overview of what psoriasis is. Now, if you're looking for more information, please head over to the GHLF's InsideOutDisease.org page. You can see that page on your screen now. It's a treasure trove of knowledge that's going to keep extending what you can learn. Covers everything from how psoriasis impacts the whole body to questions that patients or your clients can ask their doctors about treatment. We're going to drop a link to that in the chat right now so you'll have access to it. So let's switch gears. And our next question is for Brittany Timms, a creative barber hailing from Georgia, known for her flair in crafting unique hairstyles and grooming solutions. Welcome, Brittany. So you're both a stylist and a psoriasis patient. What's it been like for you navigating psoriasis in the salon?
Yeah, as a patient, I would say what's been most helpful for me is consultations. What's new for me is I've been trying a different technique with my hair recently. So I've been locking my hair for a little over a year now. So I've ventured through about 3 stylists lately. So what's been helpful is consultations, allowing them to get a kind of first look at my scalp and just making them aware of my condition and bringing in prescribed shampoos and conditioners. As a stylist, I would imagine it would be very comforting for someone who would sit in my chair who has a chronic illness. I personally haven't experienced a client with psoriasis just yet, but just speaking from my own personal experience, I was diagnosed with psoriasis when I was 13. And my stylist, prior to this different technique of my hair, I had a stylist who was my stylist from 13 to my early 30s. So a very long time.
Wow.
So when she kind of gave me the insight into, I think you might have psoriasis, to go see a dermatologist. Coming back to her and continuing to go to her, she was very sensitive with the language that she used. I found that she was very in tune with my needs. She made me feel very comfortable having a conversation with her and just going off in the world with psoriasis after that, being that we had already developed a relationship. So I believe like a stylist being knowledgeable about psoriasis can definitely make someone who has a chronic illness feel very, very comfortable. So comfortability, empathy is safety, and safety, I would say, are very helpful for a stylist to go in with having a client with that condition.
It sounds like that was very crucial, not just for your hairstyles, but also for you as a person to have somebody who had that kind of empathy and care.
Yes, for sure, especially being a teenager.
Yes,
Uh,
especially.
yeah. So dealing with self-esteem issues in general and having someone to console you and comfort you through that process was very, very helpful for me.
I was also struck, Brittany, when you said that it was your stylist who noticed there was something going on with your scalp and recommended you see a dermatologist.
She's very knowledgeable about many things, and she takes health and just her licensing in general very, very serious. As she was a stylist maybe 20 years before she even started doing my hair. So
Wow.
I definitely think knowledge is key.
And she played a lot. It sounds like she played a role in helping you get to treatment and then being alongside, really part of your whole care team.
Yes, yes, certainly, for sure.
Are there places that you would think about that stylists could get some of that besides obviously our Heroes program to keep deepening their knowledge of something like psoriasis?
Yeah, I would say different support groups that are out here, just having friends who are very comfortable with my psoriasis, people that I'm very comfortable with being myself around, and who are very knowledgeable about what I have going on. That's been helpful for me on this journey.
Mhm. Wow. Well, thank you so much for sharing your perspective and your history. I know we'll hear more from you as we go along. So, for our stylist today, one of the things that we want to offer you is a poster display that we've created for your salon that you can download and print. And you can see it now on your screen. And we're also dropping it in the chat. If you have it on display for your clients, they can simply scan the QR code. They'll have instant access to all of our Heroes resources. Of course, you can do the same thing, scan it, and have all the access yourself. And we'll also email the PDF to you after the event, along with the link to the webinar on YouTube. As Brittany has just helped us understand, your presence here and the learning that you do makes such a difference to your clients. So, Alicia, we'd like to hear from you. Alicia Bridges is a psoriasis warrior. For almost 3 decades, she's an award-winning writer, public speaker, media consultant, and health activist. Alicia, thanks so much for being here.
Thank you
Can
for
you-
having me today.
Yeah. Can you give us a glimpse into your daily life with psoriasis? What's something that you wish others knew about living with this condition?
I wish others knew how often you think about psoriasis when you're dealing with a really bad flare. A lot of times when my day starts, I'm thinking about moisturizers, and then I'm thinking about, okay, well, how are these moisturizers going to affect my clothes? Because you get grease stains and lotion stains on your clothes. And then depending on what I might have going on for that day, like if I'm going to work and I'm having a real bad flare on my scalp where the dry skin is flaky, now I have to worry about, okay, well, what type of clothes should I put on in order to conceal those flakes? Even something as simple as going shopping. When I'm flaring really bad, I think about people being able to see my legs at the bottom of the dressing room door because, they have a gap there. So it's like every moment, especially when you're really insecure about your condition, you're worried about how the representation of the disease will impact other people and how they will perceive you. And it can really take a mental toll on you and your self-esteem and just confidence on wanting to interact with other people.
Absolutely. I mean, as you say, something you have to be thinking about, even as something as simple as what am I going to wear or who's
Mhm.
going to see me in what way.
Yes, for sure.
So when you are flaring, what helps you?
When I'm flaring, it's always good to find an effective treatment. I use a lot of topicals. I make sure my skin is really moisturized. I try to take like lukewarm baths and showers. I love a hot bath or shower, but it does awful for my skin because it really strips that barrier that keeps your skin moisturized. I make sure that I'm eating right. I'm paying attention to my skin triggers. That's really important for me. Paying attention to my stress. And I manage my stress related to psoriasis through exercise and meditation. So, those are some things that I tend to do to kind of keep it at bay, keep it manageable, and kind of spearhead and advocating for myself and my health.
Yeah, absolutely. And what's been your salon experience?
It's so interesting. Sometimes you go to salons and they know what psoriasis is. Sometimes they don't. A lot of times, as Brittany said, I would call ahead. And at that time, I didn't even know that I was doing a consultation, but I would call to talk to the beautician to not only educate them to see if they know about psoriasis, and if not, educate them on that, but to also get their response to something that they may be uncomfortable with. Because I don't want to go to anyone who's hesitant or doesn't have the compassion to deal with this condition. So I like to kind of gauge their emotional relationship to the skin condition when I tell them that I have it. And then I kind of go from there.
And I heard this, now I've heard this from you. Also heard it from Brittany. You really have to be an advocate for yourself as you look ahead and think about how do you find the right person who's a good fit for you in terms of something as important and intimate as taking care of your hair.
Absolutely.
And what kinds of responses have you gotten?
Um, so for the hair salon, usually typically pretty positive. Most of the time they have heard of psoriasis. They may not necessarily know deep information about it, but they know that it's something that impacts the skin, or they've had experience with it. So yeah, I've had positive experience when it comes to beauticians. Now, when it comes to like getting your nails done or like getting a massage, which kind of all goes hand in hand. Sometimes I've been in some uncomfortable situations there, but with hairstylists, so far they typically have some type of ideal of what it is.
Yeah, that's I am really glad to hear that, and it's really part of our mission here to kind of keep spreading that. I hope that QR display that we have is something that also helps continue that education and knowledge. So is there anything that you would offer or ask stylists to be particularly aware of?
I would definitely ask them to be aware of the type of product that you're using on people living with psoriasis. I would say to ask them, do they have any prescriptions, shampoos, or moisturizers that they can bring with them to their appointment? I would be very clear about the products that you use, because some products can really irritate our scalp. So it's
Mm.
important for us to have those ingredients and products ahead of time. I would also tell stylists to be mindful of the temperature of water that you're using on that person's hair, to check in with them, to make sure that it's at a comfortable level, to make sure that it's not too hot so it doesn't dry out the scalp. And as Brittany said, I would suggest leading with compassion and empathy, even if you're unfamiliar with what the condition is. Educating yourself if you're unfamiliar with it. I think the more you know as a stylist, the more your client will trust you and be comfortable with coming to you and utilizing your services. And in turn, you will have a long-term client, because as someone with psoriasis, I'm always using the same person because I don't want to have to keep explaining what my condition is. So if you can make a comfortable space for that client, you will have a client for a lifetime.
Thank you. And that was sort of what Brittany shared as well, that she had that client for that very long time. So it's a wonderful incentive to do this work. Yeah. Thank you. Thank you for all that wisdom. So one aspect of psoriasis that has sort of been alluded to, but that we sometimes don't focus on, is its impact on mental health. And we heard from both Alicia and Brittany that there's an emotional toll that happens. And as I have listened to them, I'm reminded of the toll that psoriasis can take, that as Alicia just shared, it's a daily thought process. It never leaves the mind. I think reactions such as depression, sadness, isolation, being anxious, those are normal when you first get the diagnosis. But I just want to remind you, if those last over a long time, if any of those feelings are so prolonged or you can't shake them, then adding somebody to your care team who can help you deal with your mental health is essential. It may seem like a very simple thing, but having a caring, sympathetic listener who checks in with you about how you're feeling and can also help you sort of sort through the emotional complexities of the way the disease comes and goes and how it affects all parts of your life. When you have someone who can listen and help you do that, it makes a world of difference. That support increases a sense of resilience. It can remind you that you have the ability to deal with difficult circumstances and you are not alone. I'm grateful for the example and the stories that Alicia and Brittany have shared, sort of to show us how that can be and the difference that a caring and sympathetic person in a salon makes, just in terms of that day to day. So just to remind you, we know you're dealing with a lot when you live with psoriasis, and the more you can add to your team for help and support, the difference it can make. Dr. DeMol, do you see this as you deal with patients, the mental health toll?
Absolutely. Psoriasis, in many studies, I don't have them in front of me, have lots of data supporting a link with depression and a huge impact on quality of life. As both these women were mentioning, it every day is part of your life. It's not something you just can put in the back of your mind and kind of try to move past. Dealing with it and finding a skincare regimen and a doctor and a hairdresser who can all work with you to make it doable. It's complicated and it's hard to get started, I think, with something like that, and maybe even that frustration or fear or feeling down can often get in the way of taking the steps to find the resources that are helpful to you.
I totally agree. As a person who has had psoriasis for over the last 3 decades, sometimes the mental component of it has been the hardest, the isolation. I remember having anxiety attacks in middle school and high school. And at that time, I didn't know to call an anxiety. I knew that I had very uncomfortable feelings in the inside that felt anxious, that felt unworthy, that felt like I wasn't good enough, that felt like everybody was staring at me and judging me. So the mental component of it is very hard, but it kind of goes hand in hand. If you have inflammation in the body because of psoriasis, then it also releases a lot of those stress hormones. So yeah, I definitely dealt with a lot of mental health hardships because of this condition.
I think having a good community also can help with mental health, the whole mental health aspect of it. But for me, being in a salon, I think when you lead with compassion and empathy, that makes a world of a difference, because it could be the first day that you see this client, first of many days, or it could be the absolute last day, depending on how you address their concerns or how you show compassion or empathy when someone is dealing with a chronic illness like psoriasis.
And for the stylist, I will say that there may be some really vulnerable, uncomfortable moments. Cause I remember like when my stylist was like taking my braids down and my hair had a lot of psoriasis flakes. And so the flakes were falling on the tarp that she had over me. And it's very embarrassing. But if you don't make it a big deal, then you'll make that client comfortable. I always lead with that. I have heard some really interesting things from people, and I always keep a straight face because the straighter your face, the more they want to be vulnerable with you and the more they're comfortable with you. So I would say that too. Like it can be very uncomfortable with some of the side effects that come along with psoriasis. So just be mindful of that.
Hmm.
Yes. And earlier when Dr. L was talking, she said how psoriasis showed up differently on different skin colors. Just thinking about my personal experience with scalp psoriasis, when I did step away from my stylist when she wasn't available between that 20-year span, coming in contact with new stylists, it is difficult because I've been had questions like, are you drinking enough water? Are you greasing your scalp? Or just a lot of different health related things when it comes to your scalp if they're not familiar and knowledgeable about psoriasis. So that can be very, very uncomfortable. So again, for me, if I find comfort with a stylist, then I'm not going to stray away at all because that matters most to me, especially with this skin condition.
So, Brittany, can I ask you this? And when you began, you said you had consultations with different stylists. What would be some of the questions you would ask?
Have they ever had anyone who had psoriasis? Are they familiar with the chronic illness? How many washes do they do? It's really more so to just get to know their personality because I think sometimes when you are having conversations with someone and you learn a bit more about the personality, you can kind of tell what the experience is going to be like in the salon. So it's not just to see if they're knowledgeable, but to basically see their personality and see their heart and their mind and their soul and their spirit to see if this is someone that I would actually like to give my service to or receive services from.
Well, and share your life and the intimacy of caring for you with them. Sure, absolutely. I mean, one of the things we're talking about here is how important the significant role that stylists can play in supporting clients who live with chronic illnesses. And I think we want to be very clear that and clarify that our discussion is not implying that stylists should try to diagnose the condition in their salons. That's not their role. And not to do, but they do play that pivotal role in support and even helping somebody perhaps get to treatment. So there is a lot that a stylist can do in terms of support and help. Do you experience any of that, Dr. DeMol, as you're working with your patients? Their role with your stylist?
Absolutely. I think it's an interesting, turning point. Some people come in very ready to talk about their scalp. Sometimes, scalp psoriasis is more of an incidental finding on an exam. And so me and the stylist may start in a similar place, which is, does your scalp bother you? Right? The answer they may never have been asked. They may be very bothered by their scalp, but think there's nothing to do, or this is some variant of normal. So, the very simple question of, does your scalp bother you, opens a whole dialogue if someone's ready to have it.
Oh, that's a great opening question. And Brittany, are there questions that you would like your stylist to ask that might be useful?
I'm pretty much in alignment with what Alicia said. I think when you're concerned with the overall health of someone's hair, instead of just doing their hairstyle and trying to get them out of your chair, I think that says a lot more about how you treat your client and the concern and compassion and empathy. Because one of the main reasons that I stayed with my stylist for so long was because not only because of the comfort and the compassion that she offered with the skin condition, but because my hair grew like crazy with her. And she took care of my hair so well and told me what products to use when I got home and used those products at her salon. So I think when someone is concerned with the overall health of your hair instead of just an actual style for that particular day, I think that makes a world of a difference.
Yes, that's a big shift, isn't it? It's not just I'm going to cut it a certain way or color it a certain way, but I'm really going to be concerned with how your whole scalp is and how I can help make it better. Are there other tips that you would offer in terms of that, Dr. DeMol?
Absolutely. I think there's some amazing over-the-counter remedies. And I think Alicia brought up an interesting remedy that she explained to me last week that someone had recommended for her and that I looked into and we can chat about. So there are some really cool over-the-counter things, I think, for mild scalp psoriasis that can make a huge impact. But as I alluded to in the beginning, we're at this forefront of scientific discovery. There are amazing medications that really, truly control significant psoriasis. And 30 to 50% of patients with psoriasis are going to go on to develop that joint disease, like I mentioned, which can be not just psoriasis, like arthritis that hurts, but arthritis that's damaging to the joints. And so, we have this whole world of new biologic therapies that have gone from safe to safer. And so it really doesn't take as much of a threshold as it kind of used to in the old days for me to recommend these medicines, because they make a huge impact on people's confidence, on their lives, on their comfort, on their joint disease. Some people don't even realize they have joint disease until we give the medicine that makes it go away. They're like, oh, like, I guess that's just what I thought everybody woke up like. And so I think a huge, a life-changing conversation that a stylist can have with a new patient with psoriasis, is to bring up the possibility that this is a true medical condition that needs real medical treatment, and getting them, in touch with a real medical dermatologist, not just somebody who's doing cosmetics.
So you really see that especially as stylists might see some of those signs you mentioned earlier, or would come with a very activist patient who can speak up for themselves. And I think the example that Brittany and Alicia are giving us about what it is to really speak up for what you need and state it clearly, all of that can lead to caring for the whole health of the person and their scalp, not just, again, the beauty treatment.
Absolutely.
So anything else as we sort of end this portion of the conversation about what we wish our stylists knew, or how we could help our stylists kind of have a holistic view of this that you would want to offer?
I would say just always educate yourself. There are always new things coming out, new findings for psoriasis, new ways to manage it. So just make sure you're staying up to date with the latest treatments, so you can ensure that you refer your clients to the right place, if you come across somebody with psoriasis.
Thank you. It's coming through loud and clear. Brittany.
I think I would say is not only make sure that you're knowledgeable, but as well as your associates in your salon. Because when everybody is knowledgeable, that can, like, from the shampooer to the person who welcomes the guests as they come into the salon, I think that makes a world of a difference too, because it's like, again, like the whole saying of, like, it's a community, like you're not alone. I think with these chronic illnesses, we always feel like we're alone until we find like there's like a whole community out here who are dealing with the same thing. Like, what, 80% of 7.5 million Americans have scalp psoriasis. I believe that's still a statistic, if I'm not mistaken, but that's a lot of people who deal with scalp psoriasis. And so I think not only should the stylist be aware, but everybody in the salon and the entire shop should be aware and knowledgeable of psoriasis in general and any other chronic illnesses.
There are a few resources to help you guys find dermatologists in your area. The American Academy of Dermatology has a Find a Doctor section, where you can put in your zip code and find somebody close. And if you own a salon or just are interested in helping patients with more medically related scalp disease, you might think about giving them a call or stopping by their office. I have quite a few stylists that have my card, that know that they can give my card out to their patients when they need help. And then kind of to address what Brittany said, there is a difference in skin of color. And if you have patients in that population that are particularly vulnerable, that don't want to, see a doctor that might not understand their hair care needs, there's actually a Skin of Color Society for dermatologists that will have especially targeted interest in that patient population. So you can find a doctor on that website too. The Skin of Color Society is dermatologists with skin of color that will absolutely, all dermatologists should know, but will absolutely meet the patients where they're at.
Oh, thank you. Such helpful resources for that, for the growing this community and learning and growing deeper as we are wanting to do today. Thank you all so much for that. So we're going to take a moment here and continue learning. We conducted some Instagram polls, mini Q&A session with our Instagram community before the webinar ended, and we had over 300 participants, which was awesome. So we're going to go through these comments, and go ahead and share your comments and thoughts in the chat or the Q&A box, as we also look at our Instagram poll and what we learned from that. So the first question was about the temperature of water. Does the temperature of water matter when washing hair with scalp psoriasis? Let's see the answers. So the answers were almost pretty evenly split between only cold and the temperature isn't super important. But the answer is the temperature isn't super important. Why should we avoid very hot water, Dr. DeMol?
A very hot water, as I mentioned before, can cause a little bit of trauma, just like shaving closely to the scalp. I know Alicia mentioned that she feels that the hot water also really kind of strips her scalp of the natural oils. So I agree, kind of multifactorial. If hot water doesn't bother you, there's no reason to avoid it. But for many patients, it can be an irritant that triggers a psoriasis flare, and it does strip a little bit of more of the natural oil from your skin.
So you would say that really the temperature isn't super important, but it shouldn't be hot.
But very often people find very hot temperatures uncomfortable.
Yeah. So basically, try to stay in that medium range, as Alicia said.
Yeah.
Okay, great. Thanks. All right, the second question in our poll. Are there any hairstyles or cuts that are not psoriasis friendly? We'll see our answers. So again, we had a very close tie between any hairstyle is fine and a very close shave can aggravate. And that is the truth. So I know you've mentioned this before, Dr. DeMol, but now that we have this right here on the Instagram poll, it's aggravating because
psoriasis has an unusual phenomenon, and I'm a sucker for medical trivia. It's called the Kebner phenomenon. And again, so it's when trauma causes the psoriasis to get worse. Very often people will also see it on their elbows, often on the elbow where they lean on more, because psoriasis just likes to come up in those areas of trauma.
Okay, and so trauma really is anything that's very hard on that area that can get easily inflamed. Am I understanding that?
Absolutely. Extra hot water, really close shave, aggressive picking of this, of the scalp if it's not followed by some treatment. All of this can kind of make the psoriasis flare, bleed, and re-thicken in response to the trauma.
Okay, so when it gets trauma, it even thickens more, which is, again, can be more difficult for the person. Okay, thanks. So the third question on the poll, what are the best brushing or combing techniques for scalp psoriasis? And the answer is gentle brushing or scrub off the scale. And I think our respondents got that correct. Dr. Mole, I think we're back to that whole question of more trauma on the scalp there.
Yes, I think everybody will know the Kebner phenomenon by the time this is done. To answer some questions, like Alicia mentioned, getting some of the scale gently lifted. My preference is usually a chemical-based exfoliant, like a salicylic acid shampoo, to lift some of the scale. That could be helpful because it lets medicines get in better. Absolutely. So I'm not saying getting scale off is bad, but just manually you're not going to take your psoriasis off with brute force.
Okay, and that could be a temptation if you aren't educated about it. The idea that if I get this off, I won't have it anymore.
Absolutely. It seems like a really good fix, and our fingers, almost find relief in trying to get it off.
Right. But it actually is counterproductive, is what I'm hearing you say.
Absolutely. In the long run, we just need to get those scales off a better way.
Okay. And that leads us to our fourth question in the poll. What is the ideal hair washing frequency for those with scalp psoriasis? And the majority of people said less frequent, but the actual answer is more frequent. Now, that seems counterintuitive too, Dr. DeMol.
Absolutely. So this can be a tricky area. And it's not to say that if we don't have everyday washing that we can't make psoriasis better, but there are a lot of medicated shampoos that can be helpful. And there does seem to be a kind of a synergy with the amount of normal yeast that lives on the skin. So a lot of the psoriasis targeted therapies are decreasing the normal yeast load on the scalp. So things like ketoconazole shampoos and things like that can help really make the psoriasis more manageable just on a baseline level. There's lots of leave-in medicines, even some over-the-counter leave-in elixirs that are seeking to do what shampoos do. So it's not 100% that it has to be a wash. We're trying to move to that new pattern of hair care that not everybody wants to wash their hair every day for a whole host of reasons. So in general, the rule of thumb has been more frequent washing is better, but there's always workarounds if washing every day is not in your hair care practice.
Wow. But it isn't that you shouldn't wash your hair.
No, absolutely. You shouldn't be afraid to wash your hair that you're going to make your psoriasis worse.
Right. Okay. Wow. Well, thank you. So we have a whole lot of questions from our guests, and thank you for all these active questions. I'm going to start again with you, Dr. Demal. One of the first questions that came in is, why is it important for people to realize that psoriasis is a systemic disease and that it won't go away with over-the-counter shampoo or products?
It's definitely a multi-pronged answer there. One is that it feels defeating. You know, people come in looking for a cure like they would for strep throat, and that's not going to happen for something like psoriasis that has a big genetic component and has to do with how skin cells are turning over. So it is a more chronic disease that we're going to manage. And that's fine if we're just thinking shampoos, but 50% of my patients have joint disease, and that is something that needs to be addressed and managed. And we definitely, as a society, respect that joint disease is kind of more real and more medical. But even for my patients without joint disease, there's a growing understanding in medical literature that patients with psoriasis functions as an inflammatory marker. So it's actually a risk factor for things like heart attack and stroke. It's linked with metabolic syndrome, problems with cholesterol. We're not quite there where we can make broad recommendations based on that, but I fully believe that that's to be the case. And so I talk about diet, I talk about cholesterol, I talk about weight loss, I talk about lots of things with my psoriasis patients and don't limit it as just a skin problem. It's not purely cosmetic. Treating it is important, and it's important to your overall health.
Thank you. And you brought up something, and I'd like Alicia and Brittany to weigh in on this too, that somebody asked, is there a specific diet that people should follow that has been researched as a benefit?
Well, everybody responds differently to things. I would suggest, if you're interested to seeing how diet relates to your psoriasis, first probably start off with an allergy test, see what it is that you're allergic to, and then maybe you can um, avoid those food items and see within 3 months how your skin and your body reacts. But that's going to be different for everybody. Some people believe that eating nightshades negatively impact their skin. Some people believe that gluten negatively impacts their skin. And some people have eliminated these things and have seen results. So I think the best thing to do is to first get an allergy test and then kind of work from there.
There are very small studies on diet and things like dermatologic issues in general. And it's really hard to say chicken or the egg. They're very hard studies to do. I would say, in general, in inflammatory conditions in the skin, high glycemic index foods, things like dairy, things like white breads, pasta, rice, tend to be more pro-inflammatory. And so I'm never against somebody trying a move towards more like a Whole30 or a paleo or some sort of more, vegetable-based diet. That's never the wrong choice to eat more spinach. But in general, some amount of weight loss, meaningful weight loss, 5 to 10% of body weight, doesn't need to be some 50 or 100 pounds, but to 15 to 20 pounds can make a huge difference in psoriasis because of that link to metabolic syndrome. And so however we get there, that can be a lifestyle difference that can make a real impact on someone's psoriasis.
Wow, that whole metabolic connection is a big deal. So one of our participants asks, what are ways that patients can start the conversation about psoriasis with their hairstylist or barber? We've talked about how stylists can start the conversation. Is there anything you want us to talk about your scalp? But how about the other direction, Alicia and Brittany?
For me, it's real simple. I call and I say, "Hey, I have psoriasis. It's a non-contagious autoimmune disease that impacts the skin." Sometimes I even say it's similar to the eczema, but it's not in the same family. And the reason why I say eczema, because people can relate to that. So it kind of puts in their head, "Oh, okay, I know what eczema is, and it's non-contagious, and it's something on the skin." So it helps them to relate a little bit better to the psoriasis. And then I just go from there.
Thanks. Brittany, how about you?
I'm sorry, this whole conversation has me itching my scalp. But I would say similar to what just Alicia said, because I think a lot of people aren't as familiar with psoriasis as they are with eczema. So eczema is always a good leading introduction when having a conversation. But again, consultations, uh, like suggest consultations before even going in. I mean, as the conversation starters.
Right. Right. Don't just go in and assume it's going to be okay.
No,
Really
not at
do.
all. Because
Yeah.
a lot of them aren't knowledgeable. A lot of them haven't heard of it. And I'm not sure if this is like this around everywhere. But in the city that I currently stay in, there's a lot of people who do hair who do not have a license. And like some techniques of hairstyles you do not need a license for, like braiding or locticians. And so a
Right.
lot of them aren't really familiar with or knowledgeable about a lot of scalp about psoriasis or other chronic illnesses. So that's why for myself, because I am growing locks, I've gone to 3 stylists within the year, because I'm not only looking for somebody who knows how to do locks, but someone who's concerned with the health of my hair, who's knowledgeable about psoriasis. So consultation, consultation, consultation.
It's going to be one of our takeaway words from this, Brittany, consultation. So, Dr. Demal, what's something that you as a dermatologist wish that salons or hairstylists knew about psoriasis? What would be the top couple things you would offer?
I guess that it's, a marker of a very more widespread systemic disease, and that, while we may be able to make some of the symptoms better with topicals, that there's a role for a medical relationship to be formed, because the disease could spread. It could involve joints. It could be a marker for metabolic things. And so making the scalp better is a piece of the puzzle, and not the only goal here when I see a patient with psoriasis. I think that's number 1, 2, and 3 for me.
So, in other words, it's not just eczema, or it's not just dandruff. It's not just
Right.
whatever. But to understand this is a systemic disease, and getting treatment, medical treatment, along with however they can work with the hair and scalp makes a difference.
Absolutely.
Yeah. So we also have a question from one of our participants. Is there an unscented alternative to coal tar medicated shampoo?
By definition, tar shampoo is going to be quite smelly. I find the acid shampoo is a little bit more tolerable from a fragrance standpoint, but they're not flowers and daisies either.
And could you say that again, Dr. Demal, what the one is?
Salicylic acid is the active ingredient. I'm supposed to not use brand names during this talk. So if you look for anything that's a 3% salicylic acid, that can be helpful. Another ingredient that can be helpful is zinc pyrithione. Both of those should come up readily on Amazon, under $12 shampoos.
So to look for ingredients is what you're saying would be a good alternative. Yeah, great.
Yeah. And the National Psoriasis Foundation has something called Seal of Recognition, where they have a list of products that they monitored and tested to ensure that it's safe and effective for people with psoriasis. And it's all over the counter items, and they have shampoos and moisturizers on that list.
Great, great. Well, this has been such a deep, rich, and good conversation. I want to thank you all. And I'd like everybody to have a last word that you would offer to our participants that you're sort of taking away from this conversation. Dr. Demal, I'll start with you. What would be your major point you would want to offer?
That I think salons provide a really interesting opportunity for access to patients and access to healthcare. It's kind of an intersection of two things. It's a vulnerable place when we're kind of interfacing with somebody else in a close way we wouldn't in most social circumstances. And so stylists have a huge opportunity to help somebody kind of with a difficult disease, a disease that's impacting their mental health, their overall health. And so taking that moment of discomfort, like the ladies have mentioned, that take that moment of vulnerability and discomfort and just start with the open question, does your scalp bother? If you're not sure where to start, we can all learn together. I learn from my patients all the time.
Thank you. Brittany, anything you would offer to our participants or audience?
Consultation.
Of course.
Only because I think it makes a world of a difference. Seeing somebody's heart, seeing if they're compassionate, seeing if they're empathetic, seeing who they are as an individual before even going in to get your hair done by them. Because not only do you want to look good, but you also want to feel good when you leave someone's chair. And if someone isn't empathetic or sympathetic to the chronic illness, then it just doesn't work. So I definitely say consultation just to kind of see their spirit, get a feel of them and their personality as a whole. And I know, Dr. Gamal, you said that we should not scratch our scalp, but it is so soothing sometimes.
It is so soothing, but there are some interesting topicals, oils, prescription based. We talked about moringa oil that Alicia brought up last week that I went back and looked at. So some home remedies are helpful. Ice is helpful. I'm not to say never itch. When things itch, you scratch them, but it would be a sign to me that maybe the disease isn't optimally controlled and we could do better in my clinic.
Thanks. Alicia, any final words?
I would say if you have a bad experience with a beautician, maybe they don't respond in a loving, caring, empathetic way, do not let that discourage you. There are millions of hairstylists out here. So if one person is not giving you the care that you need, I promise you there are 10 more who will be more than open to talk and consult, word of the day, with you. About your scalp. So please don't get discouraged. Just those of us living with psoriasis, sometimes we come in contact with some really mean, nasty people, and it can feel even more isolating and stop you from enjoying these beautiful aspects of life. So I just want to give you that word of encouragement if you do happen to come across someone who's not as understanding.
Oh, thank you. Thank you all. And thank you, participants. Thank you for joining us today and being part of our Heroes community. What an insightful and exciting conversation we had. And we hope that you can take at least one thing you've learned today and use it to make your client feel supported, or if you're a patient, to better advocate for yourself. You will find our resources and more on the informational PDF, which we're dropping into the chat again. You can download it, print it if you'd like to have it on display for your patients or clients, and you can scan the QR code to access all the resources. We're going to share the link of this webinar on YouTube, so you can come back to it anytime and feel free to share it with your community. Finally, we'd like to thank our partner, Amgen, for making this event possible. And thank you to all the wonderful speakers and my fellow panelists, Dr. El Damal, Brittany Timms, and Alicia Bridges, for all they shared and their participation and profound encouragement. Don't forget, you can make a difference. Thank you.